everyone, my name is Raima Kha. Currently I am pursuing fellowship in clinical optometry under Indian Academy of Optometry IAO Coimbatore. Today I am going to share the practical for evaluation of a mixed astigmatic patient with presbyopia. So let's start the practical workup by me.
For doing the workup, first we start the workup by taking proper history of the patient, because a good history commonly leads to a diagnosis and also help us to focus on examinations which is needed when, what time it is needed for the patient. First we have to ask the patient about her name for identification, age for age related disease. For this patient, her age is 56. By seeing the patient, we can easily identify the patient's gender, which is important for gender related disease, and occupation is needed to ask for occupation related disease. Then we have to ask about the chief complaint of the patient, both visual complaint and non-visual complaint like discharge, pain, itching, swelling. After that, we have to take the patient's about spectacles history, which indicates is she is wearing any spectacles before or not. If she is wearing spectacles before, then check the present class prescription by neutralizing of lenses manually process. After that, ocular history, which is also important to know because to identify the patient is similar to having any ocular related problems or which is existed before or not. The other three important history to know is that first is systemic history. Systemic history is important to know because systemic history can be the leading cause of ocular problems. Example, if patient has diabetes, it can or it may cause diabetic retinopathy also. Systemic history include hypertension, thyroid, asthma, heart disease and malignant disease like cancer. Secondly, family history, which is also important to know because family ocular history can lead generation after generations. Family ocular history include glaucoma, myopia, poor visions. Lastly, last history which we have to take but not the least is the social history or the allergy history. Visual acuity assessment. Now we have to perform visual acuity assessment. For this patient, we have to tell the patient to wear the trial film and we have to block one eye and check the unaided visual acuity and do the other eye respectively. If the patient's unaided visual acuity is less than 6 by 6 for distance and less than n6 for near, we have to check the eye with pinhole test. For this patient, the visual acuity for right eye is 6 by 60 for distance and left eye visual acuity is 6 by 36 part for distance. So I have to perform the pinhole test for the patient, and by placing the pinhole visual acuity is increased and it is for right eye is 6 by 6 and left eye is 6 by 9, which indicates presence of refractive error for distance and near. Refraction. Refraction can be done for correcting the refractive error for distance and near and is classified into two types. First is objective refractions, where patient response is not needed, only examiner can identify the ocular problems. Objective refractions for correcting refractive error include retinoscopy or autorefractometer. Here I am using retinoscopy to perform the objective refractions. After doing objective refractions, subjective refraction is important to identify the patient's needs, where patient involvement is a major factor. Patient needs to be cooperative for doing subjective refractions. Subjective refractions include patient's response for visual assessment and duochrome test and Oxford dot test. Here the patient is very cooperative and she allowed me to perform the subjective refractions. Refraction for this patient is right eye is plus 2.00 diopter spherical with minus 1.00 diopter cylindrical at 90 degree, and the visual acuity is 6 by 6, and before refraction it is 6 by 60. For left eye, the refraction value is plus 1.50 diopter spherical with minus 1.25 diopter cylindrical at 90 degree, and the visual acuity is 6 by 9, and before refraction it is 6 by 36 partial, and for both eye near addition is plus 2.50 diopter spherical, and near visual acuity is n6. The visual acuity after refraction is called as best corrected visual acuity BCVA. The refraction value indicate that the patient is having mixed astigmatism with presbyopia. Spectacle dispensing. Optical dispensing or spectacle dispensing is a specialized area of eye care that includes the making of corrective lenses for refractive prescriptions and fitting of the lenses in the spectacle frame for proper visual correction. For this patient, I prescribe bifocal or progressive lenses with photochromatic facilities. As this patient is wearing bifocal lenses before, so I told her to continue with bifocal glasses, not to continue with progressive glasses, because progressive glasses may hamper her work as she is not wearing progressive glasses before. And patient is also suffering from migraine history, so I prescribe her to continue bifocal glasses with photochromatic facilities. So by this we can conclude that for spectacle dispensing, patient choice is to give at first, and according to history of the patient, spectacle dispensing should be done for every patient. So history taking is very important to know. Slit lamp examination. A slit lamp, which is a specialized magnifying microscope which is used to examine the anterior segment of the eye, including cornea, iris, lens, eyelids, depth of the anterior chamber, sclera, conjunctiva. It is a common part of a routine eye exam. A slit lamp examination is used to check your eyes for any disease or abnormalities. The slit lamp by microscope is one of the most useful tools for standard ophthalmic examination. Thank you for watching the video.